Welcome to another edition of Talk City Greensboro, produced by GTN, featuring interviews and events happening around town. It's an easy way to stay in the know while you're on the go. Subscribe to Talk City on iTunes, Stitcher, Google Play, or SoundCloud so you can keep up with what's going on in Greensboro city government and beyond. I'm your host, Josh Johnson, and with me today, as always, right next to me today, is my co-host, Rosemary Flybin.
Yeah, absolutely. So glad to be with you, Zooming today with you, in fact. So this month, of course, closes our second full year dealing with COVID. And of course, we're still dealing with the effects going into our third year now. Yep. Dr. Iulia Vann is Guilford County's Director of Public Health, joining us via Zoom today. Thanks so much for being with us.
Thanks for being here.
I'm glad to be here. Thank you for having me.
Okay, it is February 2022. We're kind of wrapping up our second full year of dealing with COVID. Can you tell us what is the state of virus spread and prevention in Guilford County right now?
Yeah, sure. I can't believe, guys, that we've been at this for 2 years. It's just mind-boggling that we're still in the fight against COVID. I would have never imagined that we would still be here today, coming down from the highest surge that we've ever had during these last 2 years. So it's been a really difficult 2 months. With everything that's been going on right before the holidays, during the holidays, and into January. Now we're in that downward trend for the majority of our metrics when it comes to the new cases that are being reported to us, positivity rate, hospitalizations, infections altogether, outbreaks and clusters that are reported to us. All of them are going down. But we were just so high that downward slope is taking us a little bit more, and it's going a little bit slower to get back to that baseline that where we were maybe right before the fall and after the Delta surge. So, when you start like really high up here, it's going to take a while to drop right back down. And also it's a little concerning because we know that COVID-19 and the metrics operate in this cycle. So we have increasing cases, then about 2 weeks into it, we start seeing increase in hospitalizations, and then about 3 weeks into that, then we're seeing the deaths being reported. So we've peaked January 10th. Hospitalizations are going down, but we're still in that third cycle in which now we're seeing the lives that have been lost to COVID during the surge. So now we're seeing that really dramatic side, the other side of the curve, in which we see all of the people that have lost their lives over the last 2 months because this terrible surge that we've had. So overall, we're moving into the right direction. I'm hopeful for spring from a variety of different reasons, but of course, COVID-19 seems to subside during this time of the year. So it will be a chance for us in public health to just regain our stamina because we've been going at it for a really long time, but then also for the community to just kind of get their footing again and just be able to breathe a little bit easier over the next few months. So we're in that little bit of a pending place where we can see a little bit of light at the end of the tunnel, but we don't see it super bright just yet. So being optimistic moving forward.
So, Dr. Vann, what do you think? You kind of answered this a little bit, but what do you think may be next? Like, what trends in other parts of the country are you watching?
Yeah, so we're looking at trends in United States, but then we're also tracking what is going on in other countries because we know with all of these variants that have been reported so far, they've been generating out of other countries. Most of the times, there are countries that have lower vaccinations rates where that cycle of transmission can create these mutations. So we keep an eye out for that as well. Right now, we have this twin version of Omicron, that it's somewhere on the horizon. So far, we're not very concerned about that. We don't believe that it has a greater force than Omicron as far as transmissibility, infectivity. So it will just kind of ride the wave of the original Omicron, let's say. But possible variants are going to come up in the future months as well. It just all depends on how well we're doing as a community to increase those vaccination numbers to make sure that that transmissibility cycle is stopped. All of the mitigation strategies serve as this layered approach. I think that we've said this, over and over again over the last 2 years, but it's true. One thing, when you add it to another thing, is going to make it better. When you have salad, the tomato is going to give you one set of vegetables, vitamins, and the cucumber something else, and the onions and the lettuce something else. So it's just, this is a salad of public health mitigation strategies that we need to keep in mind, with the vaccination kind of being the cherry on top.
Right.
I don't think you can put cherries on top of salads, but you get my drift.
Cherry tomato. Okay.
Yeah, absolutely.
Yeah. And
Yes.
I make a good point. Like, public health officials, doctors are learning as we go. This wasn't something that got dropped here and you knew exactly what to do and everybody knew exactly what was going to work. That's why this layered approach is kind of been the strategy. Is that right?
Yeah, so I was actually reading a book a few months ago that was it's focused on public health emergencies and disasters in general, and it's this really thick book that was published in 2017, and it describes responses to respiratory viruses, and the example was a flu pandemic. And even in the book that was published in 2017, masking, hand sanitizing, hand washing, closing schools for a period of time until we understand what's going on, they're all listed as things that need to be done. So some of these are really basic, long known mitigation efforts that public health professionals have put in place and used and known for a very long time. What made it really challenging with COVID are a variety of different reasons, but it was the fact that it was a new virus. It was the data and the science was coming so fast and so quick, trying to keep up with everything. And that's why we love science, because we always learn something new and things are not, set in stone. That's why we love the scientific method, to try to find what is going on and what are some of the changes that we need to learn about. So I think that we had a really good foundation to respond to COVID because of all of the work that has been done in the past, H1N1, Ebola, and other outbreaks or epidemics that we've had. But everything is so globalized in the 21st century, in 2020, with so much mobility, so much quick information, quick knowledge, social media, international travel. Everybody moves so fast that maybe this movement and this type of very quick information grabbing and school of thought, let's say, different schools of thought all across the nation and all across the world, made it a whole lot more difficult than before to try to contain it, contain the information, spread the correct information, and keep everybody informed with the correct type of information. That is something that we have not been prepared for. That is something that I don't think that was, I didn't see it in my really thick emergency book that I was reading that was published in 2017. So a lot of things in that area of communication, targeted audiences, misinformation, myths, and making sure that we address them, and then also the political forums and the discussion with our elected officials, with our leadership groups. That is also something that was new to both myself and my team. So we had to understand the dynamic of that in order to make sure that we give the best information for the leaders that are making choices to be able to make the best choices that they can in this time. So a lot of nuances to those very old and basic public health mitigation strategies that now took just a different turn, let's say, during 2020 and to now.
So bringing it closer to home, even what have you learned about this community during all of this? I mean, you've gotten to know, as you said, you've had to navigate different systems than you ever thought you would, and that weren't necessarily in the textbook that told you how to do it. So where have you come on that?
Yeah, so I think that it was just that it was the good part of COVID. If there's any good part of COVID, I think that this community building efforts, the partnerships, and understanding our collective minds was something that has really brought a lot of satisfaction to the work that we've done, that I've done, and motivation to keep going, to just keep moving along, looking for the silver lining. And I think that my personality also helps with that. I'm really optimistic. I'm very outspoken. I'm a very talkative. I forge relationships really easily. So that has helped with all of the different partnerships that we had to build with stakeholders that we haven't really worked with before as public health. We've had some really old and strong connections with our healthcare systems, with our municipalities, with community-based organizations and faith leaders, but other places, and the school systems, but other areas such as the business community, for example. Public health and business hasn't really worked together before. So this just kind of brought us closer to work together. I've learned, and I was new to Guilford County when everything started. I was working for the health department for a year when everything started. And I didn't actually move to Guilford County until we were just a little bit into the pandemic. So this was a new community to me, and I felt like I owe it to this community for me to be part of it, for my kids to be part of it. I cannot go to Board of Education meetings or talk to stakeholders and other community members unless I have lived experiences here in our community. If I can talk about my daughter going to daycare here in Guilford, my son going to school here in Guilford County schools. So we just kind of became part of the community as well. I've learned that we have a lot of resources here in Guilford County. I've learned that we have a lot of people that want to help and be part of the solution. But I've also learned that we have a lot of needs in certain areas as well. So we just need to all come together and address them one by one and come up with strategies to really take care of this wonderful community that we have. People love each other. They help each other. They're here for each other. We just need to be able to be that catalyst that makes it all happen.
I love that. Thank you.
Dr. Vann, do you think we are better prepared for a next time if it comes around?
Well, I think that I've mentioned already the fact that if I could have had some communications training and maybe some political science training, I would have probably been a little well off at the very beginning. But I feel like now in those areas we're doing really well. We're also engaging in our region of health departments. We're also talking about development of our staff, workforce development, training and support. to make sure that our teams are going to be prepared if this happens again. God forbid, not in our lifetime, but we need to create that foundation with these new tools, with engagement of new areas, social media, influencers, new out of the box ways to address things, technology, data sharing. All of these things are things that we had learned as we were going. So, just flying that plane as we're building it. We don't want to do that. We want to have a brand new plane that we can fly in the future that we feel very comfortable with and is going to do exactly what we need it to do. So we're focusing on data modernization in public health, transparency, and performance measures to make sure that we're held accountable and responsible for all of the things that are being done. We're investing in, again, racial equity training, making sure that we understand a lot of those underlying conditions and the social constructs that are really affecting and touching the community in ways that we didn't realize that before. So when you have a community in a population that is already dealing with a lot of challenges and trauma, adding that on top, it can be better. It can only be worse. So we need to address those underlying issues as well. We're also investing in communication training for our team members to find ways on how to draft those focused messages to our community through a variety of different platforms. So we're doing a lot of work that we've learned we need some new skills in public health, and we're working on those so we can be ready even better next time this happens, because it will be a next time. We just don't know when it's going to be. Hopefully it's going to be a while from now. But even with this pandemic, in 2018, I participated in a summit that was talking about and recollecting the Spanish flu pandemic of 1918. So we were celebrating 100 years since that Spanish flu pandemic. And in 2018, we were talking about when the next pandemic is going to hit, not if the next pandemic. And then 2 years later, it happened. So now, we know that when the next pandemic is going to happen, because we know it will, we just don't know when. Right. So we just need to always be vigilant, always be ready. And that's what the health department is here for. And Guilford County's health department is the oldest one in North Carolina and the only second oldest in the nation. Wow. So we've been around for over 120 years and we don't plan on going anywhere. So our community will continue to depend on us even 100 years from now.
Absolutely. Yes. So what do you want to leave listeners with today?
So today I would like to re-emphasize the need for vaccinations and boosters. This is truly our way out of the pandemic. It is also a way to keep yourself and the people around you safe if you are being infected with COVID-19, which is still a very slight chance for that to happen. We know people have had COVID, even if they have been vaccinated, but at a way lower rate. To have those really diminished symptoms, avoiding hospitalizations, avoiding deaths. So vaccinations. There are a lot of opportunities out there. Four Seasons Mall is doing vaccinations. The health department is offering vaccinations. Primary care providers have opportunities. And now we're learning more about the under 5 Pfizer product that will probably become available in the next few weeks. So inform yourself, read about the vaccine, ask questions, reach out to the health department. We have a free line where you can call and ask questions. Healthyguilford.com is a great place to get information. So go and get that vaccine if you haven't, get that booster if you haven't. They're safe, they're efficient, and we need to move our needle up in the vaccination rates.
Dr. Vann, we really appreciate your time today. Thank you so much for your candidness and for all that you've been doing to in the work of trying to keep all of us safe. We appreciate you.
Yeah.
Thank you for having me today.
Of course, you can stay on top of what's happening with COVID in Guilford County and find out more about vaccinations and testing by going to healthyguilford.com. That is healthyguilford.com.
Stay tuned in weekly by subscribing to Talk City Greensboro on iTunes, Stitcher, and Google Play. And don't forget, you can download Talk City from SoundCloud.
That is it for this week. Thank you so much for tuning in to Talk City. Be sure to watch GTN, your official source for news and information about the city of Greensboro. GTN is available on Spectrum Channel 13,
AT&T UVerse Channel 99,
and North State Channel 31.
GTN also streams live on Roku and the city's website
At greensboro-nc.gov.